Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Last month, the new TV program, Health and Happiness with Mayo Clinic, began airing on NBC affiliates each Saturday morning. The program showcases how simple lifestyle changes can significantly affect your health, your well-being, and your attitude.
Co-host Joey Bauer from NBC and our own Vivien Williams, joined each week by Mayo Clinic physicians, share their expertise to help us all lead happier, healthier, longer, and more productive lives. And here to discuss is our colleague, Mayo Clinic News Network reporter, Vivien Williams.
Thank you so much for having me.
Yeah.
It's great to be here.
Of course, our faithful listeners recognize her voice from the news segments each week, but now you get to be the guest, and you're nervous?
Yeah, it's weird. I'm usually the one asking the questions. People usually don't ask me the questions.
It's different sitting over there, isn't it?
It is, yeah. I'll try to answer properly and behave myself.
Okay, good.
Vivien, this has to be pretty exciting, both for you and for the Mayo Clinic.
Oh, it's wonderful. And first of all, I want to just tell everyone who's listening that some stations do run it on Sunday. So check your local listing. It all depends on what NBC affiliate is doing that day.
Okay.
But it's super exciting for me to be able to bring the messages of Mayo Clinic experts to people who can really use the material. It's just great.
How long have you been a medical reporter for Mayo Clinic?
You want me to date myself? Forever.
I don't know.
I've worked for Mayo Clinic for almost 20 years.
Okay.
Yeah.
Before you were the anchor at local TV station Katey TC.
That's right. Yeah.
Yeah. And then you sort of married into the Mayo Clinic, didn't you?
I did. It's one of those things. I'm thrilled to be here and to be able to work with Mayo.
Great. Tell us about health and happiness. How did this all come about?
Well, it started, I've been doing these stories for Mayo Clinic for so many years, loving to tell the stories of the patients, the great work the doctors are doing. And we had an opportunity. We just met some people who do programming on Saturday morning, and they said, wouldn't it be great to do medical programming? And I said yes. And I brought, my boss, Ron Petrovich, in, and we just started brainstorming, and we ended up with this show. And I'm thrilled to death. Really fun.
Is this intended for a particular audience, or pretty much has widespread appeal, doesn't it? Anybody who cares about their health and their happiness?
Totally. It's for everybody. The Saturday morning programming block is traditionally something you think about kids. A lot of teens are watching, a lot of moms are watching, a lot of grandparents are watching too, so it's really a family thing. But we do try to get, teenagers involved in healthy living because it's all about prevention, really. Stuff you do can really make a difference later.
But you're going up against cartoons.
I don't think there's cartoons on Saturdays anymore.
There?
No, their cartoons are all the time. They've got their own network, Tom.
They do. The cartoons are that big. They have their
That's
own
right.
network.
Oh,
Yeah.
sure.
So what, are you just the reporter? Are you just the anchor? Or are you just the talent? What is your role with this program?
Well, I like to think of myself as the mouthpiece for Mayo Clinic experts. I'm the translator, kind of what you do, Tracy.
Right.
We're lay people helping translate what's going on in the medical
Tell
world.
the stories. Yeah.
Exactly. That's what I do. Yes.
And how do you decide what you're going to do for each program? I mean, is it in segments, or do you have a particular topic that you concentrate on each week?
We have a variety of topics each week because we want to appeal to lots of people so everybody can get a little something from it. And the topics are really about healthy living. So it's everything from, and we focus a lot on Mayo research. And it's all data driven because there's a lot of stuff, as you know, on the internet that may not exactly be the right information that you want to be looking at. And so all the stories that we do are data driven, and it's kind of news you can use stuff. So for examples, the first episode was should you let pets sleep in your bed or not? With Dr. Lois Cron,
Right.
her study.
She's been on the show.
And
Yeah.
we saw you on your show, and it was excellent.
That's right. She would totally bum out because there are a lot of dogs in my room at night. We have 3 dogs. And then we also talk about, healthy snacking, hidden sugars, and it's not just me giving you tips. It's the Mayo Clinic expert giving the tips. So it's giving access to Mayo experts and information that some people might not have.
And how do you decide what you're going to feature each week? Their Mayo Clinic people help you decide, we ought to do the story on this, et cetera?
Yeah, absolutely. Mm-hmm.
And do you have a producer, I assume?
We do have a producer. I work with Jeff Ulrich. He's Jeff Olson, actually. People know him as Jeff Olson, and he was a co-anchor of mine here at KTTC. Tracy's worked with him.
He's been a guest on this show before.
Sure.
Yeah, he's super good. He's good in front of the camera and behind the camera. And then, so it's really a team effort. It's the typical team effort that Mayo does. We bring forth ideas after having discussed a variety of options with our team.
The thing I like is, this will sound funny, but is at the end. Not that I love when it's over, but I like at the end when you say, some ways to be happier. And, some of them are coloring, some of them are, meditating or gratitude. You get Dr. Sood in there with great gratitude tips. That's an interesting part to add into a health and wellness show.
I think it's so important too. And that's why we want to end the show with it. Because all of us, I had this is a story. I had the opportunity to interview one of the oldest women in the world, and she lived in Minnesota, and I can't remember, she was either 112 or 116. And I asked her, what's your secret? How do you stay? And one of them was bake bread occasionally, interestingly. So I started doing that. And the other one she said was step outside every day and find something new to look at, even if you can't walk, or at the end of her life she couldn't. And so she'd just go by a window. And that's sort of the message that the happy notes, that's what we call the last segment of the show, that's the message of those happy notes. And Dr. Sood and some of his colleagues are wonderful, because it's all about, being grateful for what you have and how you can be happier in life. And I think it really works.
And Dr. Pratish Tosh is involved in this as well. What is his role?
He is the medical editor. So we really want to make sure, as I said before, you can get some interesting information, medically speaking, on the internet. So we have our doctors check to make sure that each expert who comes on checks the stories to make sure they're correct. And Dr. Tosh is our medical editor, another set of eyes, and he also gives us ideas. And he's featured in the show a bunch too, because he's really good at what he does.
You don't want to give anybody misinformation. So that's why you've got this medical editor. You two seem like a great team. How is Joy Bauer to work with?
She's fabulous, and she brings on the show. She's just, she's got tons of energy, and her recipes are wonderful. And I've had a lot of people ask me, where can I find these recipes? And online, you can find them. And they're great. I've tried a bunch of them, and they're all very healthy. She's got great ideas. There's one segment from junk food to joy food. So your favorite mac and cheese, how you can make that dish into something that's a little less fattening or and a little more nutritious.
And the last one was the sausages and peppers and onions. And she's like, you got to change that up. I was so hungry for that sandwich by the time the segment was done. All right,
she is certainly vivacious.
Yes, she is.
Yeah, totally.
Tell us about the future of the program. What's coming up?
Well, some of the new stuff that's coming up, we're talking about one episode about concussions, and it features my son, who got bonked on the head pretty badly while he was waterboarding, and so we're using him as an example. I'm sure he's going to be mortified when he sees it, but that's my job to embarrass him. And so we're talking about concussions. We're talking more about how to get salt out of your diet, tips on exercise, how interval training can help keep you younger. A big Mayo Clinic study. And you may have had people on the show talking about that. And we also have stuff about vocal fry. Do you know what vocal fry is? It's that popular way when people talk like this.
Yeah, at the end.
Right.
Yeah.
And it's just not good for you. It can be hard on your vocal cords.
Sure.
We're talking about, don't put anything bigger than a elbow in your ear, and
What's the most favorite story you've done so far?
I always go for the pet stories, because I just can't help it. I love animals. So I love the pet sleeping in the bed, and I love the one that Dr. Tosh did about our puppy kisses.
Yeah.
Okay.
That was...
to have them licking your face.
And he just had this look on his face the whole time he was talking, like, it's okay, but why do you want to do it? His face was so funny. He's not a good poker player, we'll just say that much.
That is hilarious. Yeah, that's true. Yeah, I'm not sure he lets dogs lick him in the face. I'll have to ask him.
Okay, so before we wrap up, coming into this segment, we heard your news report that you give us each week. And I bet Dr. Shives doesn't even know this, and I don't know if you're going to share it, and I can certainly edit it out if you don't want. But tell me how you get the news segments to me, the person who edits the show, each week. How do you do it?
I sit in my son's closet because there's a lot of, it's very high tech. There's a lot of clothes that he just
absorb the
accumulates trash.
sound.
Yeah, a lot of stuff that absorbs sound. So I sit there in my son's closet, record it, and then I send it off to Tracy.
Oh,
You're welcome to use the studio anytime you want, really.
Thank you. Can I wear my jammies?
That's right. Stay at home in your pajamas. It's genius. I love it.
Vivien Williams, so great to have you. Thanks so much for being here.
Thanks for having me. I appreciate it.
We've been talking with our colleague Vivien Williams about Health and Happiness with Mayo Clinic, a new educational program on NBC Saturday and sometimes Sunday mornings.